Okay.
Thanks.
Thank you.
Okay, Joe. Did you find anything on the physical exam?
Well, I didn't find any signs of trauma from the fall that he had, and the neurological symptoms all seem to be grossly intact. Did notice the few issues in the cardiac exam. There's definitely a murmur.
Okay.
Definitely 4 out of 6 or higher.
Oh my. Okay.
Probably diastolic. Heart sounds are very difficult. They're very to hear. They're very muffled. Otherwise, no other rubs or gallops. No bruits noted. S1 and S2 are present. Pulmonary exam is very, very nonspecific. The lungs are clear to auscultation. Some fine crackles at the bases.
Okay.
Abdominal exam is normal. No areas of tenderness. Normal bowel sounds. There is some slight edema in the lower extremities. Pulses are abnormal. His right radial pulse was weaker than his left radial pulse. And we also did the blood pressure differential, and the right blood pressure on the right arm was weaker or lower than what was found on the left.
Okay.
What did you find in history?
Well, obviously he's dealing with some considerable chest pain. It is radiating to his back, and it's very severe. He came after waking from a syncopal episode. But yeah, he definitely has risk factors that are consistent with coronary artery disease. He also has diabetes, hypertension. It doesn't appear that he's been very compliant with his medications. He's
Okay.
also a former smoker who still occasionally smokes. So
I think it's fairly reasonable to say we're dealing with a cardiac issue here.
yes, absolutely.
What are you thinking in terms of differential?
I think definitely cardiac condition. We want to rule out an acute myocardial infarction and a dissecting aortic aneurysm. I think given the nature of his pain, we also want to rule out pancreatitis.
Okay.